Thank you for the VBMA and for having me here. I love doing this kind of stuff. So I'm Dr. Jadia Rayfidge, owner of Vet Triage. We'll talk about veterinary telehealth here, and we'll go through a variety of topics. It's impossible to talk about telehealth without talking about a variety of things in the vet field. I figured what I probably can do, because I'm not sure how many folks have even seen like what a telehealth example looks like. I thought I'd start off with an example. That's a pretty cool one. And then I've got about 4 or 5 other videos we can show at the end if folks want to stay later after we go over everything. But I figured it'd be good to start with an example.
Hello there.
Hi.
Hi. I'm Dr. Rayfidge. Nice to meet you.
Nice to meet you. I'm Erin.
Hey, Erin. What do you have going on?
So I'm fostering. Well, they were 2 pregnant. One had her kittens on Friday. The other one. I'm gonna turn my camera around.
There you go. Yep.
There. The other one. So she was fine, and then one of my main cats got under the door and stressed her out a little bit. And then, like right after that little tiff she had with the other mom cat, she started like acting a little bit more weird, trying to go up to the mom cat. And then she was like, kept trying to go back to her, and she wants more attention now. She's purring pretty rapidly more, very minimal discharge. So I don't know if she actually is going into labor, but she keeps trying to lay in the bed with the other cat and the kittens. So did maybe the stress just cause something, or is she in labor? Do I have anything to worry about?
Gotcha. Okay. All right, cool. How old is this one?
Honestly, I have no idea. We got them this is going to be this cat's 3rd litter.
Okay, so, that was my next question. How many litters this one had? Okay, so this is the 3rd litter. Very good. And do you know approximately when she, I guess, how long she's been pregnant for?
Probably around the same time. So like, I really don't know. I got them when they were already pretty pregnant. So I've only had them for about 3 weeks now.
Okay.
She's not as poofed out as the other one was right before she gave birth. So maybe she's just a smaller litter, and her nipples are still.
Yeah.
You know.
And then how many babies are in there? Is anyone taking X-rays?
No, this has completely been home stuff.
Gotcha.
I feel maybe like 3, but sometimes it's hard to tell.
For sure. Let me look at her. Let me see. If you were to pick her up and then like put her on the bed, can you do that and then watch what she does?
Yeah.
Okay. I want to see. No. Boo-boo. Let's see what she's doing here. Is she on any medications or supplements?
No, she's not on anything. She's on kitten food and then wet food once in the morning, once at night. So she went back to her bed, but earlier she just kept trying to go back to this cat and her kittens right there. So now she seems to be going back to here. So now I'm thinking she's in labor, but she really doesn't have a lot of discharge.
Yeah.
She has some, but not a whole lot.
No, here's the thing. I agree with you. I mean, the nesting, the neediness. I think that's all. I think she is, if not in labor, going to be in labor tonight.
Okay.
This is fairly. So what I would actually think of doing, if you're okay with it, is just minimize stress in the room. Maybe dim the lights. Kind of give her own space. Let her do her thing. You know, watch her from a distance and see what she does. Have food and water available for her and see what she does.
Okay, and then I guess my next question is, so originally me and my sister were gonna like each take one of the cats. So if she does take this one, it would obviously have to be after she's had the kids, right? Because we don't want to stress her before she has them.
I think so. I think it's a smart idea. Whatever we can do to minimize stress in this cat's life, because
she's having contractions.
Yeah, there you go. Yeah, let her do her thing.
Okay, so then after she has the kittens, what's like a good time frame that she could be moved with them? I just don't want any stress for the other mom, and I don't want continued stress for her. So they're okay for the most part, but
The easy answer is no one knows that, right? But I will tell you that as a board certified surgeon, having done plenty of C-sections, dogs and cats, I will say that the second the surgery is done, the mom's awake, the kittens are awake, the kittens are nursing, mom is good, I send them the hell home, like they go. So, and it's literally hours after surgery, hours after giving birth with a C-section. So I would say the second the kittens are out and they're nursing, mom is good, move them whenever you want.
Okay, all right.
Yeah.
Well, I think that's it. I mean, she might just have a slower labor than the other one did, but.
Let's do this because it's still early in the night. I'm going to email you, and I'm going to send you a blank email. I'm going to send you a blank email. That way, if you have any updates for me, if you want to send me pictures or videos and say, "Hey, doc, it's been 3 hours. Here's what's going on so far. What do you think?" or whatever. Or you may not need me, but let me at least send you a blank email, and that way you can at least have access to me beyond this video session, so we can make sure things are good with mom here.
Okay. All right. I appreciate that.
My pleasure, of course. But yeah, I think you're on the right track. I would say dim the lights, let her chill. And and I don't know if having the other mom and the kids in the room is more stressful or more relaxing. It's kind of your judgment call.
Yeah, I mean, the only other option would be to have her give birth in my room away from the other cats that are in my house and then her, but then I'm not sure if that new environment would also make it just more stressful for her because there's a bunch of new smells. The other cats' smells are predominant there because they sleep with me.
Then yeah, whatever is least new, I would say is the way.
Okay, so just keep her in here and keep an eye on her.
Yep, that's fine. Just dim the lights a little bit and keep things kind of chill.
Okay, all right. Well, I appreciate your help.
Of course, my pleasure. I will send you a blank email here and we'll get you, and just keep me updated if you want to. Yeah.
Okay, great. Thank you so much. You have a good night.
You too. Bye-bye.
Bye-bye.
All right. So that's a pretty good example of what we do every day on vet triage for telemedicine. So we'll go over the definition of veterinary telehealth, the current veterinary culture, current legislation, veterinary telemedicine as a fourth pillar, telehealth types, a little bit about vet triage. I don't want to be too salesy, obviously, but we're the only ones that operate in the way we operate. Medical literature, future goals, summary, any questions, and then I've got some more examples if folks want to see some more videos. This is in the AVMA website that tries to find the different branches of telemedicine, telehealth. So this is where I live, and currently where a lot of the laws will allow us to live is with teletriage. But you can see here there's teleadvice, telemedicine, e-prescription, telemonitoring, etc. Most folks forget that the actual broad category of telehealth is telehealth. Telemedicine is just one branch of telehealth. So if you try to define the broad category, it's something like veterinary healthcare services using telecommunications technologies, and the client patient are at different locations than the doctor is. This is an example of a dog that we did on vet triage that got skunked. And so we're just talking to the client through baiting the dog to get the smell off. So telemedicine is a branch amongst many branches of telehealth. Telemedicine talks about consulting, treating, care management. It's a tool of practice, not a separate discipline. And so I'll go over why I think this is probably something that we want to change with telemedicine. Then there's teleadvice, again, just another branch of telehealth. Any health information not specific to a particular patient's health, illness, or injury, it's just general advice, which, it's hard to draw the line between advice in general and advice as it pertains to that specific patient. But there it is, there's teleadvice. This is a picture of a woman who owned a kitten that had flea anemia. So she found the kitten, it was infested with fleas. She tried killing the fleas, and the poor cat is like severely lethargic, pale mucous membranes, tachycardic. So we sent her to the ER to get care. Teletriage is where I live and where the vast majority of other companies operate, because that's where legally we can live. And also it seems to be what's needed right now with the current culture. So this teletriage is the immediate referral to a veterinarian or not regarding the patient's condition. And so this is where we live. And for that example that I just showed you, a pregnant cat, is this an emergency or not? Do we have to take further action at an emergency clinic, or can this be monitored at home? And you see we chose the monitoring route. Telepractice, teleconsulting, telemonitoring, etc. This is just my friend Lindsay. She's just showing her dog here as a model, just hanging out. So let's talk about veterinary culture. That in essence is how telehealth is broken up. And those other categories, telemonitoring, telepractice, there's examples of that in vet med, and there are some that need to be more fleshed out. We don't really have e-prescriptions, for example, but we have like teleconsulting. If you talk about board certified radiologists, when you send out images to a radiologist, right, that's teleconsulting, vet to vet. So we've been using these tools for a long time. This is not new. So the veterinary culture. So veterinary school admissions from 2020 to 2021, admissions increased by 19%, which is insane. Before that, every year, it's about 6 to 7%. So for some reason during the pandemic, it just skyrocketed with the number of folks who want to become veterinarians. If you look at the stats with regards to salary for veterinarians in 2020, it's about $100,000, about 87,000 jobs available with veterinarians. They're actually expecting a 17% growth with vets, so adding about 14,500 new vets. And I'm not surprised by that. If you combine it with this increase in admissions, and the fact that we have the largest number of vet schools in our history, so which means we're pumping out the largest number of veterinarians per year in our history of veterinary medicine, that makes a lot of sense. And a huge aspect of this that we'll go for in the next couple of slides is going to be debt. I average $150,000 in debt as of 2021. This is a hypoglycemic puppy that we helped manage at home. It just didn't eat enough, played too much, and became really weak and lethargic. And so we end up putting some sugar on her gums. And as you're going through the video, you can see the puppy get better and better. So to continue on with veterinary culture, a lot of you folks probably already have either experienced this yourself or are hearing about this. If you haven't, you're going to. This is rampant throughout our field. Mental health is a concern in 92% of veterinary staff. The combination of being in debt and concern for suicides, 88%. The concern for staff shortages exceeds 90%. These are all things that are on veterinarians and veterinary staff members' minds. These are the things that are currently plaguing the system. And so a lot of papers that you look at and studies look at the Kessler psychological distress scale. I'll show in the next slide what that is, but to use that scale to decide how mentally healthy or not you are. In 2019, veterinarians who underwent this study, 6.4% were somewhere in the severely distressed category, like severe psychological distress. And you see the number went up to almost 10% in 2021. And then of course you can say, well, the pandemic, right? Obviously, it compounded everything, but these are concerning numbers. Veterinary staff hovered between 17 and 18% during those same years. Burnout, veterinarians, 30% burnout. Staff members, 50%. This is just an example of that scaling system that they use. It's a 10 questions that tries to dictate what level of psychological stress you're under. And this has been shown to be a fairly reliable method as far as trying to figure out like turnover rates, suicide rates, what have you. And those are what the studies are looking at in terms of the health of other professions too, not just veterinary. When you look at another aspect of veterinary culture, you have to contend with turnover rates. So turnover is how many times you have an employee leave your facility, how many times you have to replace an employee that's lost in your facility. Every time you lose one person, it costs about 20% of their annual salary. So if you lose somebody who's making under $50,000 a year, that's a $10,000 loss to replace them once they've gone, right? And that cost also includes dealing with whatever their struggles are during their employment there too, $10,000. And if you can imagine, most staff members, who aren't doctors, they're making under $50,000. So this is a substantial amount of financial loss. Those who have higher paid jobs, every time there's turnover for them, it can be up to 213% of their salary. So if they're making $150,000 a year, you lose a lot of money every time you have turnover for somebody who's at a higher level in the field, in that hospital. The average veterinary team, 23% turnover every year. A quarter of your staff leaves every year. And the long work hours, which is one reason for the turnover rate, staff members complain about it 50%, veterinarians pretty much 50%. It's a big problem. Here's a vet triage case of some rabbits. This is basically herd health. A bunch of rabbits had red areas around the eyes and the ears. And so she was calling because all her rabbits have this issue. Another aspect to it, aside from turnover rate, is burnout. The percentage of veterinary staff that are happy with their work-life balance is 40%. The general population, like non-veterinarians, are 60%. The burnout rate is not even related to the number of hours per week worked. So it's not even like a work thing. It's not like you're being overworked and that's why you're unhappy or you're feeling burnt out. It's actually related to a lack of balance, not enjoying your work, not finding work invigorating, and having conflict with one or more associates. These are all cultural things. These are all things that are occurring inside the veterinary clinic that you're operating out of. And of course, it's common amongst all veterinary clinics in our field. This is another vet triage case from Alaska. That's a baby sea otter. We triaged a sea otter on vet triage. And here it is again, this freaking cute thing. Insane. Suicide rates. I mean, awful. And veterinary staff have a higher suicide rate than the general population. Veterinarians are 2.5 times more likely to attempt suicide. The percentage of veterinarians who've thought about it over the past year, 7.5%. Those who planned it, 1.4%. Those who actually went for it, less than 0.2%. Is horrible. And it's all just negative culture. The most notable predictor of prior suicide attempts is that psychological distress scale. So we've got to fix this. I mean, these are not small numbers, and it's systemic. So what are some solutions then for mental health? Obviously, I believe telemedicine is a solution, but what are some more local things you can do with this kind of thing? Well, in 2021, 33% of veterinary staff members have had methods that they used to try and mitigate the mental toxicity, the cultural toxicity, the burnout. 33% tried something. That means 66% didn't try anything for their mental health. That's not good. And probably one of the more common questions I get now from veterinary students is, how do I save my mental health? Like, that was never a question when I was graduating. 12% of veterinary staff members have access to materials that they can use to help with well-being and mental health, but 16% of those have serious psychological stress. Like, they're not using materials that are handed to them to try and help with this. Is there coverage with your employer? 27% have coverage, 50% have no coverage to try and help with mental stress. If you work with a financial planner, those who do, only 3.3% have serious psychological stress. Whereas if you don't work with a financial planner, almost 10% have severe stress. And there's a difference here too with well-being. Younger people are having a lower sense of well-being than older people in the vet field. And these are just some stats. I mean, there are so many numbers you can go through to see that the veterinary staff members, both doctors and non-doctors, are really skewed towards this type of mental anguish. So when you look at future generations, so you guys, right? Only 33% of veterinarians would recommend the profession. I'm sure all of you have heard veterinarians say, oh, don't be a vet, don't be a vet. It's sad. It's the first thought we have. Don't be a veterinarian, do something else. 42 to 52% who would not recommend the profession would not recommend it because of student debt, because of low pay, and because of stress. And I'm surprised by this because when I talk to veterinarians, obviously most of my colleagues are fairly seasoned. Debt doesn't even come up. Even low pay doesn't really come up. It's all stress. It's all stress. So a lot of these studies might be focusing on younger folks who have debt on their mind, and that would make sense. I think as you go on in your career, if things aren't changing, the stress is going to become a bigger and bigger factor here. The burnout amongst veterinarians are greater than medical doctors, despite the fact that veterinarians surprisingly work less hours than human doctors. Cyberbullying. 70% of veterinarians think it's an actual issue. And I'm in that camp as well. 20% of vets report it, 12% have experienced it, 20% had a vicious review in the past year. Cyberbullying. To a doctor, it's insane. Here is a vet triage case of a goldfish. They bought this goldfish 2 years ago at a carnival, and the poor thing was having swimming issues. It unfortunately passed away, but this was our very first goldfish on, and now we've had, I think, about 5 fish come on through vet triage. Most of them are actually happy cases. So unfortunately, this little guy didn't make it. Here's a squirrel on vet triage. Somebody has a squirrel in their closet, and look how fat it is. I told her, I said, she goes, oh, it was calling us for like upper respiratory tract signs. And I said, by the way, you need to have this thing lose weight. So now let's go into some current legislation, right? The veterinary client-patient relationship, the VCPR. This is massive when it comes to trying to spearhead a movement in telemedicine like we're trying to do. It's the basis for interaction amongst veterinarians, their clients, and pets. It is viewed as being critical to the health of animals, which I would argue, no, it's not. VCPR is, as defined, the physical interaction, the meeting of in person between veterinarian, pet owner, and animal in person. I would say it's not critical to the health of animals. Clearly, because we're functioning in that capacity now. So you're not supposed to be able to diagnose without a VCPR, prescribe with a VCPR, without one. You need to have a VCPR in order to diagnose and prescribe. And again, I would argue in that cat example, I mean, did I need a VCPR to go through the fact that this cat was pregnant? Now you could argue, you say, well, you need x-rays and stuff. Sure, of course. But I'm not sure what else to diagnose that cat with other than she's pregnant, So there's issues there. And then we'll talk about prescriptions in another slide. Then you've got patient limitations. So we all know there are some pets that are just horrific at the vet hospital, right? And this has been shown both in people and in animals, white coat syndrome. White coat syndrome is defined as physiologic changes that occur due to being physically present at the doctor office. The physiologic changes that occur in the patient because you're at the office. My dad gets this. He breaks into a sweat. Blood pressure goes up, heart rate goes up when he's at the doctor. Same thing for animals, right? A feral cat, an aggressive dog, an exotic pet, birds. So white coat syndrome is a real thing, and it does result in cardiovascular and neurologic changes to the patient. If you can examine that patient at home, you see them in their natural environment, you eliminate the white coat syndrome. Animals don't know they're on camera, so they are not going to be nervous. Then there's client limitations, financial, geographic. Maybe they've got physical or mental disabilities. Maybe they don't have a car. Maybe they live in a remote area. We will service areas in the US that the nearest hospital is a flight or a boat ride away. So what do you do if you have a bloat or something? Let me see if there's a cool map. If you go to, I won't click on it because I don't want to mess this up, but there's a map at this website. We're part of this organization called VVCA, the Virtual Veterinary Community Association. It goes through what states in the US allow for a VCPR to be established with telemedicine, as opposed to having it only be established in person. More and more states are opening up. They're following the human side. I think there's 49 states that allow for a similar relationship between a medical doctor and a patient. Veterinary medicine is opening up. There's a handful of states now that will allow you to set up a VCPR by telecommunication means. And this is important when you talk about a physical exam versus any exam. Because obviously if you're examining a pet on video, you have to utilize the client's, the pet parent's hands. It's not you doing it, but it's still an examination. It's still worth something. So that's part of the argument that we're trying to make here with this. So they talk about in various organizations and legalities that a physical exam is critical because a patient cannot speak for themselves and clients misinterpret the symptoms of an animal. Again, I would disagree with this. I agree that patients can't speak for themselves, but I would disagree in that clients misinterpret the symptoms. The client knows the symptoms, they live with the pet, and so who else are you going to get the symptoms from? It's got to be the client all the time. VCPR cannot be established by telephonic or electronic means. We talked about that. And veterinary telemedicine can be used as a means of healthcare only after VCPR has been established in person. Without establishing it, a veterinarian is unable to provide appropriate level of care and diagnosis needed to assist the animal patient effectively. And again, I would disagree with that as well. We have almost 10,000 cases on vet triage where we've been able to help with some level of care with the client over video. So these are things that are going to probably change because this is already here. It's part of the future and it's already here. This is one of my friend's dogs that we looked at from triage in the German Shepherd. You can see he's got this red lesion here. It's actually involving the iris. He ended up having to get a enucleation because he had an adenocarcinoma of the iris. He's doing fine now. So the AVMA Model Veterinary Practice Act is what protects clients from telemedicine being used inappropriately, except when there's an emergency. So consumers definitely have to be protected. Obviously, you don't want telemedicine to run wild. Nothing should run wild in medicine. And I do agree it is very useful in emergency situations. And thankfully, at least as of right now, you don't need a VCPR for performing telemedicine in an emergency situation, which is basically what vet triage is. They're all emergencies. It's all triage, hence vet triage. And so that's how we can perform this responsibly and legally. An emergency situation we determined by review of a veterinary expert case by case, taking into account the animal status and the reason why the client reached out to you for an emergency telemedicine session, which is exactly right. It's exactly right. So let's talk about medications, prescriptions, because this is also not black and white. Obviously, a VCPR is required. You have to have the relationship with the client. However, there are some organizations that believe that even over-the-counter products or supplements or nutraceuticals or diets, non-prescription diets, are considered prescriptions because you as a veterinarian are recommending it to a client. I wholeheartedly disagree with that. To me, a prescription is a medication that requires a prescription. So if you can find it over the counter, fair game. That's how I see it. Not everybody's going to agree with that. For me, if a client has access to it over the counter on any shelf in a grocery store or a pharmacy or wherever, I'd rather have them using it under the direction of a veterinarian than going under than their own research or a Facebook chat group or whoever. I'd rather have a veterinarian tell them how to use that over-the-counter product rather than they just guess on their own. You don't want an owner giving a cat a human non-steroidal anti-inflammatory. And that's an extreme example, but that's an example of why that would be inappropriate. So I believe telehealth should be the fourth pillar of veterinary medicine. You know, you've got rescues, you've got GPs, you've got ER, you've got specialists. I think telehealth is right in the middle. I think it's able to bridge the gap amongst all these organizations, or rather these different parts of the field. And I think we should actually elevate telehealth to where it should be considered a separate discipline. Unlike the previous slide where they mentioned that telemedicine should not be considered a separate discipline. I disagree. It's got nuance to it. It's got technology to it. It's got confidentiality limitations to it. It's a whole different branch of training. And so I think that you're going to end up seeing that over the next few years. So I made this chart to kind of exhibit that I think telehealth can bridge the gap between all these functionalities. We're not going to spend too much time on cybersecurity. Just be aware that cybersecurity is a big deal, even in GPs, ER, especially hospitals. I've known folks who had their files stolen by hackers and in veterinary clinics. And so, you know, this is a company that I recommend pursuing. Good friend of mine who owns this company. And so I'll leave it at that. You guys, I think, will have access to these slides after this, so you can go through and read all this stuff. But there's been some major cyber attacks in the vet field. Let's talk about different types of telehealth. And Emily, feel free to stop me if there are any pressing questions. So there's three categories here of telehealth. There's software, there's non-video, and there's video. And again, this is my classification. This is how I see it. I haven't found any resources that sort of categorizes telehealth, so I categorized it. Asynchronous implies that there is going to be some kind of a delay between when you receive the information or image or video from that client and to the point where the veterinarian can assess the video or image or email or text or whatever and then respond back to it. That's asynchronous. It's not real time. So I put it as a subcategory because you could argue, is texting back and forth with a veterinarian in real time, is that synchronous or asynchronous? Because it is happening, not at the same time, but it's happening fairly quickly. So how spread out is that? Versus if I get an email from a client today, but I respond tomorrow, that's clearly asynchronous. That's not in real time by any stretch. And it's more delayed than texting. But texting is more delayed than a real-time video, like you just saw with that cat example. So asynchronous is not necessarily synchronous with non-video, but it tends to be related. The same thing with video telehealth. If a client sends me an actual video via email, but I look at it later, well, it's asynchronous now. It's not in real time. Or you can have what I just showed you, synchronous, real time, live two-way video. So these are general categories. So software is the first category. Companies will sell their software or lease it out to clinics so their vets can do their own telemedicine. We find, and I'll show you some studies on this, it may not alleviate the inherent challenges that veterinarians face. If I'm an employer and I have veterinarians on staff, I kind of don't want them stuck on a computer. I want them doing surgery or administering vaccines or taking care of hospitalized patients, performing radiographs, collecting blood work, right? I want them doing stuff. And so I'm not really sure this is the best way to go, but it is an option. Then you've got the non-video. So you can email, texting, phone call, but no videos involved. And, you know, it's a bit sketchy as far as who's answering these calls with these other companies, but someone's answering them with whatever quality you want to deem necessary there. I don't know. And whether or not the 24/7 is up to a company and there's species limitations. Most folks, as you can imagine, are dogs and cats. Whereas I already showed you probably like 10 species that we've dealt with. But this is again, these are generalizations, folks. I don't want to. These are generalizations. So just you're always going to find exceptions. And then there's of course my company. We're the only ones that do it this way, where it's only veterinarians. It's licensed vets, live, 24/7, on demand, no appointments. The cost doesn't change for the client, all species. I own the company, so it's veterinary owned and operated. So I know how to manage this. This was a rescue organization that I managed / hospital in Las Vegas, Heart to Live. And so we did kind of just a demo for the pictures here. And you can see we have vet triage masks. Yay. So we find with vet triage, the stats are less than 20% of our cases need to go to the emergency room. We see that with clinics that utilize our services, whether they are small mom and pop practices, GPs, or whether they are large 24/7 ER specialty. We've seen them, they make more money because they lose less money and they get their cases back. There's more recruitment for staff members. There's increased retention of their staff members. You see an improvement with culture. They're happier to work there because they know they can offload their burdens onto a company like mine. So this is what we're seeing. And this is what I mean. This is why we did so much. This is why I talked so much about culture before, because we're seeing improvements in culture by our services directly and indirectly. Here's just an example. I have a YouTube channel, which you're more than welcome to subscribe to. It's got a bunch of educational videos on there tailored towards veterinary students and veterinarians, some for pet owners. Well, a lot for pet owners, but you can learn stuff from it if you want to see how I talk to clients about allergies or TPLO or whatever. Anyway, so that's my YouTube. And then just our other social media platforms. Vet Triage has a YouTube channel, and then we've got Instagram for Vet Triage and for me. And it's all educational stuff and what have you. So just to be out there. We create flyers for hospitals. This is just, I'm not going to get too salesy here. This is just, I'm just showing you like the things that we do to help vet clinics reach their clients so they know that we exist. They can use us to whatever capacity they want to use us with. Let's go into some medical literature. Unless, Emily, there are any questions or anything that you want me to?
So far, so good. We're hanging in there. It's really interesting.
Good. So literature. So 2006 study, they looked at how many papers on telemedicine are there in veterinary practice. They found 25 papers. 2 of those papers had actual research in them. 16 of them had no references. Think of all the research papers, I think, at this point, you guys read or you will be reading. No references, 16 of them. And then 1 author had multiple papers. So this is anemic, to say the least, in terms of medical literature out there for the veterinary profession. What are some common themes? Well, you know, how you can use telemedicine, sure. What the benefits are, where they're using telemedicine, ethical and legal issues, obviously. Image standards, how to obtain images, the equipment you need, educational aspects to it. Oh, sorry, the same rabbit picture from before. But here's what I liked here. Veterinary practice has lagged behind its human counterpart in producing research on the validity and efficacy of telemedicine. Is an important field which requires further research. Yep. Yes, it does. Yes, it does. And that's what we're doing. Spearheading a movement, folks. Spearheading a movement. Another study here looking at using telemedicine for, I think, about 2-week post-op neuters for dogs. And so clients were happy with the telemedicine appointments. They thought they preferred it. Some clients preferred it to being in person. Most did. Most preferred it. The majority thought that the video and audio were clear. 100% were comfortable with technology. 94% would use it again. 82% of dogs were more comfortable. So this is just like, look at the incision, get a general history, do your thing as a recheck. And so it works really well for post-operative rechecks. Yay. It's really good. Save you a trip to the hospital. Another study looking at VCPR. So the most common reason for owners not to follow up with a traditional veterinarian is financial limitations. And so with telemedicine, you can keep your costs down, and that way you increase access to care, right? Traditional care veterinarians agreeing with the information provided by telemedicine. That's awesome. Like, that's huge. And we find the same thing. We have follow-up on our cases, and the vast majority, whatever we thought might be wrong with that pet, turn out to be right. That's without diagnosing anything, without diagnostics. The percentage of owners that have an existing veterinarian in person, 76%, and over 90% would actually use an alternate mode of communication if they had access to it. So it just shows an interest. It shows a need and an interest for telemedicine. Another study here, I think this is in the UK, they were showing in general, is a large study surveying veterinarians. Basically, veterinarians have no idea how to talk about telemedicine, how to categorize it, what it is, the definitions of telehealth and telemedicine. They just don't know it. And they're not even sure they're doing telehealth there. Now, if you think about it, the moment phones were invented in the veterinary field, you're doing telemedicine now. You're performing telemedicine because you're on the phone and you're trying to triage something over the phone or trying to give advice over the phone. We've been doing telemedicine since the 80s. It's been commonplace. We just don't think about it that way because now with the pandemic, it sort of is expanded on this concept. But veterinarians did not even realize they'd been performing telemedicine, email, text message, phone calls. You've been doing that. This is my classmate, Dr. Bruno. She's looking at her dog's teeth for me. Another survey looking at veterinarians defining telemedicine. Again, they couldn't. The answers were all over the place in terms of how do you define it? What do you think about it? There's no standardization for the way veterinarians are thinking about this. Another classmate of mine, Dr. Aline, he's there with his cat. Another study here looking at, looking at the future of veterinary telemedicine, how it's going to progress, which, it's going to grow exponentially. Of course it is. The development, incorporation of telemedicine in the curriculum, in formative years of veterinary students training is critical to ensure effective and efficient training of students in telemedicine in the COVID era. And I would argue it goes beyond COVID, right? Because it's not going to go anywhere. It helps too many people and too many animals for it to go anywhere. There are some big players in the game, and we're one of them. And I do think it needs to be in the curriculum for veterinary schools. I think it does. And there's a lot of nuance to this. So it should be taught. This is interesting because it shows that clients are willing to pay. So dog owners are willing to pay $38 more for a telemedicine consult with their family veterinarian. $38 more than the regular consult fee. More to stay at home and talk to their vet, the vet that they trust, they know via telemedicine. And if you're like, well, how much would you pay if it was any vet in your area with telemedicine? They pay $13 more than the consult. Most consults are between $60 and $100 for GPs, and then ER goes from $100 to $150, sometimes $200, and specialty can go up to a few $100s to meet with the doctor. So this is interesting. Clients would actually pay more to be able to not go into the clinic. Cat owners are willing to pay $38 per call or visit with their vet, and $12 when it's a vet that's not in their community. Still, cat owners are willing to pay more. So there's an interest there. There's an interest amongst pet owners. It's not about the money. You can charge whatever. That's not the point. The point is that clients actually see it as a service they would pay more for than going in person. Whereas you'd think, well, isn't it more valuable to be there in person, right? The vet can palpate your pet. And from a client's perspective, they'd pay more for this. Portuguese veterinarians is a survey to find out what they're thinking about this, the overall opinion. with telemedicine, there should be reductions in restrictions. There should be improved guidance and regulation. I agree. 80% of them believe that there should be limits to veterinary telemedicine. I would agree as well. 66% of them thought that a remote consultation should always be preceded by face-to-face consult. I disagree with that. I don't think it's necessary in all cases. Most thought that vet talking to vet with social media should not be banned, but it should be regulated by ethical standards. Sure. I mean, vet to vet is sure, you know, it's different than talking to clients. You know, the social media thing for clients, well, you know. The concerns they have with telemedicine have to do with reputation. That's what they're worried about. They're not worried about privacy. They're not worried about confidentiality. They're worried about reputation, things going wrong. So if we can show, so with that, if we can show with data that you can perform a large number of telemedicine cases and not have any trouble, that should be a win for telemedicine. It should give veterinarians confidence in knowing you can perform telemedicine safely and appropriately. Another study in the UK looking at equine veterinary surgeons who treat racehorses, they found 4 big points here. The trainer-veterinarian relationship is predicated upon a good working relationship. And I agree with that. And the undertone of that is, do you need a VCPR to have that relationship? With vet triage, for example, we formulate a healthy relationship with our clients, even though it's the first time you're meeting them. So do you really have to meet face-to-face, or can it just be a good relationship? There was little or no change in the veterinary trainer relationship during the first lockdown period. This is during COVID. So COVID didn't really affect the relationships. When COVID-19 restrictions were enforced, there were the more remote consultations were viewed favorably. So that's good. Images, videos, telephone. And connection problems and poor quality of the images and video. Yeah, that's definitely, any company will deal with this type of stuff. That's difficult. Another study here looking at telemedicine. This is during the pandemic. So in clinics, so 66% reported little to no difficulty in adopting video conferencing, which makes sense. You know, a lot of people now they're FaceTiming and whatever. So that stuff is still pretty good. And, you know, 66 is a good number. It still means, you know, like 34% of them are not okay with it, you know, or have some sort of difficulty with it. 45% report telemedicine took less time, but 76% reported telemedicine results in less financial compensation. And this is the problem with doing telemedicine in a brick and mortar, an actual facility, because that veterinarian's hands are very valuable. Your hands and your brain are so valuable in a brick and mortar. It's like, why you waste time doing it in telemedicine? Offshoot it to a company like mine, and you can do real veterinary work in person. You're going to make less money with it, sure, but it is faster, so that's good. So it kind of depends on how you want to operate. But that's very interesting numbers there. And this is more of a medically oriented study. They were looking at comparing gait analysis, orthopedic exams using force plate and video. So you have like a doctor look at the dog in real life, and then one look at a video and kind of see if you can come to the same conclusion. And so there was high correlation between the two things. So you can even use it for, like, you know, diagnosing things, or at least getting some sort of picture as far as orthopedic health with dogs. So that's cool to see. Finally, we'll transition to future goals. We recently partnered with Cornell University, yay, where I graduated. University of Minnesota, in progress right now. Long Island Veterinary Specialists, which is a massive hospital in Long Island, New York. That's also where I was trained. So we've got fairly large institutions that are partnering with us now. We're hoping to get more involved with academia because they need help as well, as I'm sure some of you know. We are publishing our own data. I should have 2 papers coming out soon on demographic studies with what our clientele are, what the species are that they're helping with. And we'll have bigger papers after we set up that foundation, probably like 2,000 cases, which in the vet field is a massive number of cases. And we've got almost 10,000. So it's just a matter of publishing data. Lobbying efforts, we try to help open up BCPR, not to make it the wild, wild west, but help open it up. We work with a lot of media. We are working on expanding vet triage. We're working in Australia now, and we're trying to expand to UK. University partnerships, like I mentioned, and of course, emergency teletriage is where we live. We've lowered the wait times at emergency hospitals. They're having 2 to 6 hour wait times. In Oregon, they were having up to 72-hour wait times for ER, which is still faster than when their family vet can see them. So 3 days is better than 3 months or whatever it's going to be, right? So we help lower the wait times with emergency teletriage, and we partner with universities and with larger ER hospitals. And that helps everybody out, everybody. So in summary, I think that some of the legislation, as you probably can tell from my tone, are fairly antiquated. There's room for improvement, and there's lots of fighting ahead. Then we need to establish a gold standard of veterinary telehealth. We have to recognize that the profession, different types of telehealth. So hopefully now you're a bit more well-versed in what the types are and how it's broken down. We really should recognize telehealth as its own pillar of veterinary medicine, and we really need to change the culture. And I think with telehealth, if we can lower the workload of veterinary clinics, increase access to care, you'll see less negative online reviews, less turnover, higher retention of your staff members, easier hiring of staff members, all that. And that's one. It's not the silver bullet, but it is going to be a major force. And we've already seen it be a major force in improving veterinary culture. Contact me anytime, my email, website, all the social media stuff. And I figured, since a lot of this stuff is kind of a downer, I wanted to show you guys, this is the follow-up for that cat. She emailed us that night, 3 kittens. She guessed it. She goes, oh, I think 3 kittens. 3 kittens came out of this cat. So it's a nice, happy ending, despite some of the depressing talk we've had. Look at that. Wonderful follow-up. So help her with peace of mind and save a trip to the ER. And there you go. New kittens are born. So thanks for having me. And any questions or comments I will take.
Yeah, thanks. We do have a question in the chat. It says, how would you deal with an issue in seeing the problem the client is utilizing the telemedicine appointment for? For example, a dental issue, an animal is not allowing the owner to show in the camera.
So a couple of ways you can do that. One is